Systemic sclerosis, SSC, also known as scleroderma, is a complex autoimmune disease characterized by fibrosis, vascular abnormalities, and immune system activation. Management of SSC focuses on symptom control, slowing disease progression, and addressing specific organ involvement. Here's a comprehensive approach to managing systemic sclerosis. 1. General management. Patient education and lifestyle adjustments, smoking cessation, essential to improve vascular health. Skin care, regular moisturizing and protecting skin from injury and cold exposure. Exercise to maintain joint flexibility and overall health. Nutrition, balanced diet, and if needed, interventions for gastrointestinal involvement. 2. Pharmacological management. Skin and fibrosis, immunosuppressive agents, methotrexate, mycophenolate mofetil, or cyclophosphamide can help reduce skin thickening and internal organ involvement. Antifibrotic agents, nintedanib has been approved for slowing the decline in lung function associated with interstitial lung disease, ILD, in SSC. Physical therapy to maintain skin and joint flexibility. Vascular involvement, Raynaud's phenomenon, calcium channel blockers, nifedipine or amlodipine to improve blood flow. Phosphodiesterase 5 inhibitors, sildenafil or tadalafil for severe cases. Topical nitrates for acute attacks. Endothelin receptor antagonists, bosentan for digital ulcers. Pulmonary arterial hypertension, endothelin receptor antagonists, bosentan, ambrisentan. Phosphodiesterase 5 inhibitors, sildenafil, tadalafil. Prostacyclin analogs, epoprostenol, treprostinil. Gastrointestinal involvement, proton pump inhibitors, PPIs, for gastroesophageal reflux disease, GERD. Prokinetics, metoclopramide or domperidone for gastroparesis. Antibiotics for small intestinal bacterial overgrowth. Dietary adjustments, smaller, more frequent meals, and avoiding late-night eating. Pulmonary involvement, interstitial lung disease, ILD, immunosuppressants, mycophenolate mofetil, cyclophosphamide, antifibrotic agents, nintedanib, regular monitoring, pulmonary function tests, and high-resolution CT scans. 3. Management of specific organ involvement. Renal crisis, angiotensin-converting enzyme ACE inhibitors, captopril, enalapril for blood pressure control and renal protection. Monitoring, regular blood pressure checks and renal function tests. Cardiac involvement, arrhythmias and heart failure, standard heart failure treatments and medications like beta blockers or antiarrhythmic drugs. Regular echocardiograms to monitor heart function. 4. Monitoring and follow-up. Regular assessments. Multidisciplinary approach with regular follow-ups with rheumatologists, pulmonologists, cardiologists, nephrologists, and gastroenterologists. Screening for complications. Regular screening for PH, ILD, renal crisis, and other complications. 5. Supportive therapies, occupational therapy, to assist with activities of daily living. Psychological support, counseling, and support groups to help cope with the chronic nature of the disease. 6. Advanced and systemic sclerosis, SSC, also known as scleroderma, is a complex autoimmune disease characterized by fibrosis, vascular abnormalities, and immune system activation.
Sorry for that interruption. Let's continue. Number 6, advanced and experimental therapies, stem cell transplantation, hematopoietic stem cell transplantation, HSCT, for severe refractory cases. Clinical trials, participation in clinical trials for new and emerging treatments. Number 7, preventive care. Vaccinations, regular vaccinations, including influenza and pneumococcal vaccines to prevent infection. Bone health, monitoring, and managing osteoporosis risk. In conclusion, the management of systemic sclerosis is highly individualized and requires a comprehensive multidisciplinary approach to address the various manifestations and complications of the disease effectively. Regular follow-ups and monitoring are crucial to adjust treatment plan and improve patient outcomes. And again, sorry for the interruption.